Welcome back to the final hour of my stand-in for Ian Dale, which I've thoroughly enjoyed, and I make no apology for returning to the subject of alcohol. We talked in the first hour, you may remember if you were listening, to Hannah, a recovering alcoholic, to Amy Winehouse's stepmum, and also to the chief exec of the charity Addaction about the problems of addiction. We also had the joy of listening to, for a while, to Russell Brand, who phoned in from Essex. And I want to come back to alcohol because I want to ask this question. Is alcohol drowning our National Health Service? And I'm going to, by way of introducing the discussion, I want to bring in, can I say, my doctor, as it were. I was in hospital recently with, you don't want to know the details of this, but I had a bout of dysentery and was in there for a few days, got to know the medical team very, very well. And my liver specialist, I couldn't quite work out why I had a liver specialist, but he was Dr. Gautam Mehta, who's with me now. Now, the reason I was really interested in talking to you on the programme tonight is that when I talked to you, I remember saying to you, it must be a nightmare, and they're all free. Friday, Saturday night, A&E, people drunk. And you said, when it comes to alcohol in this hospital, A&E is just the start of it. Now, what did you mean by that?
It's the tip of the iceberg, Alistair. Evening, thanks for having me. Look, so I'm a liver specialist, so we see the very kind of conventional things you expect. I mean, liver disease from alcohol is shooting up in this country, and that's sadly one of the things we're good at in this country compared to the rest of Europe is drinking ourselves and getting ourselves liver disease. But look, when you work in hospitals, you see that the problems of alcohol permeate every ward, every single specialty. Even for clearly things like psychiatry, people get addiction problems, suicide, trauma in the orthopaedic wards. But, there are people in maternity and gynecology who have alcohol problems that need to be seen by alcohol specialists. There are people who have cardiac problems from alcohol increasingly. And there are frightening figures. So alcoholic liver disease, I think, is the 5th commonest cause of death in this country. But if you look at the under 65s, alcohol-related deaths is the 2nd most common. It's frightening, and it's only increasing.
How bad is it in A&E on a Friday, Saturday night?
So A&E, classically, as I'm sure you'll hear from people right at the front line later, is terrible. And the number of preventable costs, the cost of alcohol is between 20 and 40 billion a year, and a lot of that is the acute stuff and binge drinking. But it's not just A&E on a Friday and Saturday. I think that's what we were discussing, which it really is a problem that of people who drink to excess throughout the week and develop the chronic problems, as well as the people who you see perhaps famously coming in on a Friday and Saturday.
And what's the sense of the burden on the health service that comes from alcohol?
Look, huge. And again, it's the iceberg thing again. There are, I think, something like 1 in 4 adults in this country drinks to harmful levels. We think, something like 33% of men, 15%, 16% of women. Women rising, that ratio rising rapidly, and the problem is really one of just increasingly that burden is affecting adults.
You mentioned women. I mean, the book I wrote recently about a woman alcoholic, and one of the reasons was because of a liver specialist in Southampton. You may know Nick Sherrod,
no, I do.
Who told me that when he started out in his career, the male-female breakdown of his patients was 9 men to 1 woman. And now it's about 50-50.
Yeah.
Are you saying the same thing?
Yeah, absolutely. The two groups that are rising are women and, unfortunately, young people. And I think women especially are the most rapidly rising group. But I think it was only a couple of weeks ago in the press, this staggering statistic about something like 300 kids under the age of 11 being brought to A&E over the course of a year. And then between the 11 16-year-old young
7,500, I think.
Huge numbers, yeah. So young people, women, these are the key people that we need to try and target now, because they're the burden of not just liver disease but lots of chronic illnesses in the future.
And when you're talking to a patient who has a drink problem, and they have a drink problem, and that's what they need to address. I mean, you're a liver specialist, you're not a psychiatrist. How do you confront that?
Look, it's very tough. I mean, we need support from all disciplines, really, and we do get help from people in psychiatry and psychological services, but it's very, very tough. I think a lot of it is resource, and that is part of just a reflection of the fact we're drowning in this problem. Only 6% of people get the help they need, really, who have addiction and dependence problems, and that's a tidal wave of liver problems that we just can't stem.
I'm talking to Dr. Gautam Mehta, top liver specialist from the Royal Free Hospital. I want to hear your views as well on 0845 60 60 973. Do you drink too much? Do you know people who drink too much? Are you worried about your own or somebody else's alcohol consumption? And what do you feel when you go into the accident and emergency units of London hospitals and see the impact of alcohol within the National Health Service? Dr. Mehta, when you first started work in the health service, I mean, have you sensed it getting worse? Or, because I feel it's getting worse just walking around the streets, but maybe I'm like a convert. I'm just a bit too sort of keen on noticing it. But do you feel it?
No, look, it's absolutely getting worse. So, we know that in North London, where I work, the figures are sort of 20% worse from in the current year from sort of 2010, 2011 time.
And what are you calling as being worse? Are you talking about admissions to where you are?
Total number of alcohol-related admissions, not just liver problems, but all alcohol. And I think we worked out something like if you it's of the order of 210 a 210 bedded unit occupied 365 days a year is where we are currently with alcohol problems. Just in North London, the sort of UCL type. Royal Free, UCLH type hospitals burden, and that's predicted to double in 6 years. But even just the feeling you get from working on the wards is that there are alcohol problems that are just increasing in the different manner of ways they present. So it's not just your standard alcoholic type person who's coming to hospital, but you're seeing it more and more across the specialties and with different problems.
Like
heart problems, like people coming in who have another medical problem but actually have alcohol dependence as well and need that to be attended to. Heart problems, stroke, chest and pneumonia type problems.
Okay, are you happy to stay and take some calls?
Absolutely, yeah, why not?
Graham in Sevenoaks.
Good evening to you.
Hello, Graham.
I was only thinking about this a matter of minutes ago for a very good reason. First and foremost, I will tell you very briefly, I packed up drinking about 5.5 years ago. I was drinking too much, mainly because of work, and I realised I wasn't enjoying it. I've never felt so well, and I don't need it anymore. I don't need to drink. The problem is, I have a very, very special friend who lives quite a distance away. He has bipolar disorder, and I rang him only this evening, a matter of minutes before I was speaking to you, and he is drunk. It is almost every night. I know he's very unwell. He does it habitually because he says he likes it. He doesn't care about the fact he's killing himself. He smokes on top of it. He's got no money because he can't work. And I just think it's tragic because I don't know what help he could get, but he doesn't seem to care about it. I wish, and I've tried to help him and say, I packed up. I was never as bad as that, but I was drinking too much, and I'm so pleased I packed up. But I don't know what to suggest to him. And he's so intelligent. When he's sober, I have a great conversation with him. But when he's drunk, he's completely off his face. I understand it, but I think it's tragic because people are doing it to themselves without realising why.
But did you feel, Graham, when you were drinking, because I know I did when I was drinking, that when people, how I saw it, nagged me about it or told me I was doing the wrong thing, it didn't always help. I mean, it's a very, very difficult thing to know how to help a friend.
It was the worst thing, not so much from friends, but it was because of family.
Yeah.
But it certainly didn't help me. But I wanted to give up. I realised it was damaging my health. I wasn't enjoying it. I was doing it for a habit. Mm-hmm. And I found it a lot easier to pack up than I thought. And seriously, 5.5 years on, nowadays the worst I ever do is very, very low alcohol-free wine, which I'm quite happy with. But I even that I can do without. But with my friend, I try and listen to him. I support him, I understand, but it's very difficult because I can't get a coherent conversation out of him. What can I do when he's completely sozzled?
Let me ask Dr. Mehta, how do you, if a patient comes, if a friend of a patient comes to you and says, how do I help somebody who is fundamentally damaging their health, what do you say to them?
I mean, look, evening, Graham. It sounds like a really tragic story. I think this friend of yours really does need some psychological help, and I guess it's hugely difficult and really traumatic for families and friends of people who have alcohol problems to get them to seek help. Increasing availability of resources for these people is key. I mean, like I said, only less than 10% of these patients really get the help they need. I find it very difficult to offer access apart from the GP or local alcohol-type services. Hopefully things will get better. I mean, there are there are increasing ways to monitor our health these days. There are we're in the age of technology. There are ways people can monitor their alcohol intake, but the psychological burden is really tragic.
Graham, thanks for calling. It's 7:15. Travel news now. Here's Adam Moore.
Thanks, Alistair. Starting with the train.
Welcome back. We're talking about alcohol and the impact upon the National Health Service. I'm with Dr. Gautam Mehta, who works for the liver specialist at the Royal Free here in London. And I want to hear your calls as well on 0845 60 60 973. Are people drinking too much? Is the National Health Service paying too big a price for that? And are there policy solutions that we should take? Like, for example, one that I took to the Labour Party conference and the Tory Party conference with the charity alcohol concern, the demand for minimum unit pricing. David Cameron was all in favour of it when he produced his alcohol strategy last year. But then, under a bit of pressure from the right wing of his party and also from the industry, which is pretty powerful, he backed down on it. Some Conservative MPs have stayed consistent in their views, and one of them is joining me now. Conservative MP for Totnes, Brixham and the South Hams, a former GP, Sarah Wollaston. Sarah, how are you?
I'm good. Hi, Alistair.
Was that a fair and accurate assessment of the situation on the policy of MUP, as we call it?
Well, yes, I'm very disappointed. I'm told that it isn't completely dead and buried, but unfortunately it's clearly in the very long grass, and I think that's a great shame. I think we could do so much more. As you know, this is all about price, availability and marketing, and whenever we see alcohol being sold at pocket money prices, it's going to be very difficult for all the other measures to be as effective as they could be.
What's your sense of the state of play within the Conservative Party? Do you think most Tory MPs were pleased that the Prime Minister changed his mind?
I think on both sides of the House, Alistair, there are MPs who just feel and have been persuaded by the industry that this somehow is going to penalise people on low incomes, when in fact the evidence just isn't that that's the case. And in fact all this does is get rid of damagingly cheap alcohol. And for most people, it doesn't affect it doesn't affect at all the cost of a pint in the pub. It just gets rid of the kind of sort of 23 pence a unit white cider that's killing people.
And what about what are the other policy ideas that you think the government should at least consider? You mentioned marketing there. I mean, I'm amazed the extent to which alcohol advertising is now, in a sense, grips sport. I mean, do you think that's something we should look at?
Yes, I do, and I think it's the way it's targeted directly at young people as well. No one's suggesting that adults going about their everyday business should be interfered with necessarily, but actually when you look at the targeting of it and you look at the way the rules are being sort of sidestepped, I mean, we have all sorts of policies that say you shouldn't claim that alcohol makes you sexier or that alcohol makes you better at sport, and yet we're allowed advertising to go hand in hand with high achieving sort of sporting figures at sporting events, and that's damaging. But it's not just that, it's the use of advertising in so-called adver games on the internet, and the way that alcohol markets using products that are widely used by young people, or being able to set up a profile on your website which clearly uses alcohol brands. And we know that advertising does have an effect. It means that you're more likely to start drinking at a younger age and drink more when you do.
Well, so they wouldn't spend £800 million a year on it if it wasn't having some impact, I wouldn't have thought.
Exactly, and it's not just the marketing; it's availability. It's a real wasted opportunity that we didn't allow health to be an objective for licensing conditions, because I think that's what people really want within their local communities, where they can see it's causing harm, to be able to control the number of outlets. I mean, why is it that people in an area where there's already a problem with alcohol should have no control over sort of so-called bargain booze outlets in their neighbourhoods? And that's what it's about. If localism is to have any meaning, people should be able to have a say and stop that kind of thing.
And what's the impact of alcohol abuse in your constituency?
Oh, enormous, in everyone's constituency. And the point is, as well, it varies from area to area within a constituency. So you might have one area where there's a real problem with street drinkers, and yet in that area, densely packed, there are outlets selling high-strength alcohol at ultra-low prices, and that's what we need to be able to tackle to make sure that not that we're inconveniencing people unnecessarily, but where you can see there's a harm, you can target measures that help those people. One person described it to me who has had a long-term problem with drink as having a bit like having a dealer on every street corner. Very difficult.
Sarah Wollaston, thanks very, very much for joining us. That's Dr. Sarah Wollaston, Tory MP for Totnes, Brixham and the South Hams. And listening to all that, the Director of Lifestyle Choices for the Institute of Economic Affairs, Chris Snowdon. Chris, presumably you thought that was a left-wing claptrap.
Well, not left-wing so much as rather authoritarian. So I suppose David Cameron's in favour of this idea. It's not left-wing per se, it's just rather paternalistic. And I'm surprised, really, that more people in the Labour Party are not against it. I know, to be fair, a number of people in the Labour Party do oppose it, but it's such a blatantly regressive and class-based strategy. It's going to cost roughly £2 billion, which is to say the price of alcohol in this country will rise by £2 billion. The majority of that is going to be borne by people on low and modest incomes. Sarah Wollaston is not right in saying that this is only going to affect very, very cheap lager and cider. It's going to raise the price of round about 75%.
Well, it depends which research paper you read on that, Chris, to be fair. And I think that there have been plenty of analysis suggesting that actually the rise will affect those on low incomes very, very modestly, and those will pay the most to those who are drinking the most expensive booze, which tends to be the people at the top.
Well, no, the people at the top tend to buy more expensive alcohol anyway. This is not going to affect politicians with a subsidised beer. It's not going to affect doctors on six-figure salaries. This is really about people on six-figure salaries making people on four-figure and five-figure salaries pay more for their alcohol.
But have you seen what's happened in British Columbia which is the one part of the world where it's been tried and it's been run for several years, and they have had substantial impact upon the figures of people dying through alcohol abuse and people needing hospital treatment through alcohol abuse.
Alcohol-related mortality in British Columbia is actually higher than it is in Britain. And I know the study you're referring to, and there's no point going into battles of statistics on the radio. Suffice to say that there hasn't been a decline in the number of hospitalisations or the number of alcohol-related deaths over the last few years when they put the minimum price up. But let's remember, we have already amongst the highest alcohol prices in the world. There's only really Ireland, a couple of Scandinavian countries that come close to us. Most EU countries don't tax wine at all. We have £2.50 on a bottle of wine. Do you know how much the cost of an average bottle of spirits is in tax? 79%. If high prices were the key to health, then Britain will be one of the healthiest countries in the world.
No, I do. I mean, I was in Spain last week where they were telling me that wine is virtually untaxed. And they were talking about
months ago, 99 cents.
But does there come a point where I regret the fact actually that so much of this debate focuses on minimum unit pricing, because I don't think it's the silver bullet. I do think that we have a serious problem with alcohol and we need a serious alcohol strategy. I mean, would you at least accept the argument that Britain has a serious problem with alcohol?
Well, I don't think we have much greater problem with it than we have in the past. I mean, alcohol consumption has fallen by about 20% in the last 10 years. Certainly there's a perception that things have got worse, and the fact that alcohol consumption has fallen doesn't mean that things haven't got worse.
Can I bring in Dr. Mehta, who's been with me, Chris?
Hi, hello, Chris.
Hello.
I suppose one of the key things to realise is that as a liver doctor, the rate of death from alcohol-related liver disease has not decreased over the last decade. It has increased fivefold over a couple of decades, and that's alcohol-related liver disease. And the predominant reason for that is the availability of cheap alcohol, and that's based on a couple of straightforward facts, which is that the relative price of alcohol over the last couple of decades has decreased by about 300%, and that's been the main change in the biology of this disease. Look, so disease happens through the individual, the population, the environment, or indeed the main causative factor. So the rest of the environment hasn't changed. The population hasn't really changed. We're the same as we were. The key difference is the availability of cheap alcohol.
And I think, am I right in saying, Dr. Mehta, that we're the only major European country where death through cirrhosis, which often caused by alcohol abuse, is rising.
No, absolutely. So, in Europe, we're not great at many things. We can't beat Montenegro away at football, but what we can do is damage our livers through alcohol. Look, we of all the European countries, we are the main country where alcohol deaths are rising year on year. Every other country has got falling rates of alcohol.
Right, but we have amongst the most expensive alcohol in Europe, so that would suggest that putting the price up isn't going to help things. Our alcohol consumption is slightly below the EU average, so that suggests that trying to reduce overall consumption is not going to have effects with people who've got drinking problems. I believe that the whole problem with the way public health people look at alcohol is they try and treat it like cigarettes. So they're interested in banning advertising, putting the price up. Now, with cigarettes, it makes a certain amount of sense to try and reduce per capita consumption.
But surely it makes why doesn't it make sense to reduce per capita consumption of alcohol when it's doing so much damage to so many people?
Because most of the alcohol is drunk by people who don't have a problem with alcohol and are not going to suffer any health effects from it.
But they're not going to suffer any... Sorry, Dr. Mehta.
So I was just going to say, one of the things about minimum unit pricing as a strategy is that it does preferentially target very heavy drinkers, and that is the key population that are going to be affected and going to die from liver disease. So if you have cirrhosis, which is an increasing disease, and you carry on drinking, you have a 50% chance of being dead in 3 years. Whereas if we can stem that tide of alcohol misuse, then actually the same people have got a 75% chance of being alive 10 years. So this is
how many people die of liver cirrhosis, alcohol-related liver cirrhosis every year?
So it is the commonest cause of...
How many people?
Liver, I don't have an exact...
About 3,000 or 4,000, I think.
Okay.
And obviously that's a tragedy for each of those people and their families. But there are about 400,000 people die every year. What I'm saying is that minimum pricing may have some effect on the margins.
Now, but let's get away from that, Chris. What about the bigger point about an alcohol strategy that looks at pricing, looks at availability, looks at treatment? We don't actually have an alcohol strategy, in part, I think, because of what I define as a right-wing libertarian view that you hold, that basically says people should be free to make their own choices about everything.
Well, I'm saying that alcohol is already extremely expensive. The idea that
I agree with that.
Reduce harm by making it even more expensive has been tested to destruction. The part of the alcohol strategy that I think needs to be focused on is targeting the people who need help, treatment for people, rehab and so on.
Okay.
But that requires going out there and finding people who are in a bad way. And a lot of public health people, I'm afraid to say, are too lazy to do that. They'd rather just go lobby politicians for broad brush policies like banning advertising and minimum pricing.
All right, Chris, thanks for that. This is Alistair Campbell. I'm standing in for Ian Dale on LBC 97.3. It's just after 7:30. With the news headlines, here's Peter Ferris.
The wife of a pensioner who was killed at Campbell.
Welcome back, just after 7:30, and we've been spending this last half hour, and we'll spend the next half hour talking about alcohol and the impact upon the National Health Service. I want to hear your calls on 0845 6060 973. Now, a week ago, I was watching the television, and somebody had said, you must see... in 999, what's your emergency? Tonight it's about the ambulance services, and I don't know if the programme started out in this way, but it turned out to be all about the impact of alcohol upon the work of our ambulance services. And one of the ambulance paramedics who was on the programme was a gentleman by the name of Tommy Lemon. And I saw the programme, and I got in touch with London Ambulance Service, and I said, would it be possible to get Tommy Lemon or his colleagues onto this programme? And here in front of me right now is Tommy Lemon. Tommy, thank you for coming in.
Thanks for inviting me.
Not at all. What struck me about watching the programme was that it seemed to me that, I don't know if this is how the programme was designed and was worked out, but it seemed to me you were dealing with alcohol all the time. Is that what it's like?
I think on the weekends that's definitely the case. We go to a lot of alcohol-related calls. Friday and Saturday nights is the really, really peak time. So, yeah, a lot of the stuff we go to is just people who are drunk, people who have had a fight, people who have fallen over, all alcohol.
I mean, I can remember when I was growing up, when a policeman, if not that I was ever, well, actually I was drunk a lot of the time, but if you were seen by a policeman and you looked a bit worse for wear, and they made you walk down the line. If you couldn't walk the straight line, you got taken away for being drunk and disorderly. It seemed to me that your job and the job of the other emergency services was kind of almost like taxi services. You were driving around at one point, taking somebody home, and actually he was taken to the wrong. He hadn't lived there for 4 years. He'd sort of just forgotten that he hadn't. I mean, how does it feel when you're just dealing? I mean, you were. I don't know whether it was because the cameras were there, but you were amazingly patient. You're amazingly kind of understanding of the guy who was sort of both end incontinent, as far as I could see.
Yeah.
And you were. I mean, what was it like?
You kind of accept the fact that that's going to be part of your job, and as long as you don't get bitter about it and accept that these people are going to go out and get absolutely riddled, and they're going to need someone to pick them up, and the police are stretched incredibly thin, so are we, so's A&E, it goes across the board. So as long as you just deal with these people one-on-one and are nice to them and friendly to them, then normally you can just get that job done, get it out of the way, and then go on to the next one.
And what's your sense, though, of whether it's... I mean, you talk about Friday and Saturday, and Dr Mehta, who works in the Royal Free, he was saying actually that A&E at the Royal Free now, it's not just Friday and Saturday, it's kind of pretty steady through the week. I mean, is your sense that the drink problem that we have is worsening? Is your sense that actually there are more incidences that you're dealing with that are to do with alcohol, or is it kind of fairly static, steady?
I can only speak personally on what I see from the working in central London from the ambulance station I work at. But I see that it's not just Friday and Saturday nights. That's the really, really peak times. That's when it's, like I say, sort of 9 jobs out of 12 are just alcohol.
Yeah.
During the week, you're still picking up people throughout the week, even during the days, the sort of habitual drinkers and the people that live for drinking. And bless them, you know, they're trying hard, but they just drink a little bit too much, and then someone calls an ambulance for them, and that's it. The job is in place, as it were.
Okay, we're talking about alcohol here. We're going to take some of your calls in a moment. If you want to join the conversation, it's 0845 60 60 973. And with Tommy Lemon, who's a London paramedic, who was in the 999 What's Your Emergency programme you may have seen last week, and also with Dr Gautam Mehta, who is a London liver specialist. Let's go to Adam in Uxbridge. Adam, good evening.
Hello there. Hi there, gents. Well, I'm no expert like the two experts you've got on, but my working career has taken in contact with a lot of alcohol problems as a bouncer and as a prison officer dealing with resettlement of people with severe addiction problems, the majority being alcohol, strange enough, not actually drugs, which might come as a surprise. And now as a magistrate. And the two guys you had on before, there was some merit in what both of them said. Yes, as a nation, we probably drink less than other nations in Europe, having recently come back from the Balkans. I can definitely tell you that's so. However, we do seem to have a hardcore where there's a drinking culture where people are drinking to excess in this hardcore. Now, to actually dismiss them all as people with an illness that need help, I think would be probably disingenuous. There are a hardcore people in which the culture of drinking doesn't seem to carry the shame it would have done maybe about 40 or 50 years ago, where if you got drunk and couldn't hold your drink, you were seen as an idiot.
I think you may be right, Adam, that we're drinking slightly less than we were a couple of years ago, but we're drinking double what we were drinking in the 50s. I think that's the comparison. And you know, I've got Dr Mehta here who can. Well, Dr Mehta, what's your response to that?
Yeah, hi, Adam. I guess part of the problem is that I think a lot of people are drinking at harmful levels that may not even know it. So you're right, there is a very hardcore of people who drink an awful lot, and they really are at risk, right? And they're perhaps the ones that would maybe be helped most by pricing. I guess that's something we've already discussed, but there are plenty of people out there, and I think a lot of this is awareness and learning about how alcohol affects your health. Hopefully that's something that we'll get out as a message over the next few years. We all know what smoking and obesity does. I think alcohol is hopefully the next big public health message. But, you know, one in 4 people probably drink too much, such that they're going to have health problems, most likely liver disease, but stroke, heart problems, all the rest. And they're not necessarily the ones that you see or that Tommy sees on an ambulance on a Friday and Saturday.
Adam, thanks for that. I'm going to go to Cindy in Pimlico.
Hi there.
Hello, Cindy.
Hi, Alistair.
Fire away.
I'm really chuffed to speak to you because I did see your programme, and I was quite touched by your programme, and I'm really glad to see that how you've come on from your programme. I am an alcoholic, and I'm probably an active alcoholic, although I'm I'm a functioning alcoholic.
Okay.
Are
you working?
No, but I'm a single parent of 2 boys.
Okay.
So I don't drink every day, but when I do drink, I drink from morning till evening, and it's probably every sort of 3 weeks or something that it happens. And the reason I've called you tonight, because chuffed that you were on, and it's given me an opportunity because I have drunk today. I don't know really why I do it, but I know that I do it. I don't know what else to say. I just felt compelled to phone. Really.
I mean, is it possible that you've phoned because you want, in a sense, you want to say that you have a problem and you want somebody to help you deal with it?
Kind of, but I kind of have done that before. I've admitted I'm an alcoholic. I've been into clouds before. I succeeded, but I came out of clouds, and it took me 20 minutes to relapse.
Right.
So I've done all the rehabs. I don't know.
What about your boys? I mean, how do you deal with them, and how do they deal with you?
They're 21 now.
The twins.
And yes, twin boys of 21. I try to hide it, and I've tried to hide it today, but I'm actually at this moment, really, literally at this moment, I've done dinner, I've held everything together today, but I still think they're aware. They know, and that's quite hard, and they're avoiding me at the moment.
Dr. Mehta.
Gosh, that sounds like it's been really tough for you to handle over the years. Where do you think you can go for help from here?
Do you know what? And the thing is, I have a lot of support. I have a care worker. I have a psychologist that comes to see me. I've had about 4 months ago, because of being so drunk and trying to take my own life. This is very difficult. I jumped out of my own bedroom window about 25 foot and broke my own heels, and I'm still recovering from that. And my sons have had to care for me since then.
Were you drunk when you did that?
Yes. So I have little memory of it.
Right. And when you were drinking, like you're drinking today, because we had a discussion earlier where people were saying, "Oh, people who drink, they do have a choice."
No.
Are you drinking because you want to drink? Do you feel compelled to drink? What's making you drink when you know you shouldn't?
I always say, and I had this discussion with my sister a little while ago, I always think it's that third drink. I like that third drink, which makes you go, oh, yeah, that's the one that I just want to feel just all right on. I can't stop there. I just want that third drink. I don't never stop there, and it tends to fall into chaos. But at the moment, and particularly today, I'm holding on very tightly to not let things descend into chaos, because I'm a self-harmer. I've presented to mental health institutions. I've done all of that over kind of like the last 10, 12 years. And I feel that I'm making progress because of the support I've got, but I'm still dropping back into that every 3 weeks, kind of doing 2 or 3 days drinking.
Well, listen, Cindy, I'm really grateful that you took the trouble to call. I don't know if you know, I do some work with Alcohol Concern, and they do have Drink Line. I don't know if you're aware of Drink Line, where you can phone for help and advice. It's 0800 917 8282, and if you didn't get that, we can put it on the website of the programme. And I can only say, as somebody who had a drink problem, the first thing you have to do is to admit to the problem. You've done that. You've gone through clouds. You've gone through the rest of it. I just hope that you do manage to resolve your issue. All the best. Tommy, how often do you have to deal with people like that?
We're one of the first ports of call for them to dial 999 and say, I'm either considering hurting myself, or I've drunk too much, or I don't want to be here anymore. We do take that very, very seriously. Obviously, kind of goes hand in hand with people becoming quite difficult patients when they've had that much to drink. And there's some people that we know on first name terms that we go back to week in, week out, who...
Just on that, don't you feel... I saw there was one of that in the programme. I don't think it was you, but two of your colleagues who were saying, oh, yeah, we know who it is, we know what he's like, and the rest of it. And he ends up on the streets. Now, you know, and Dr. Mehta said earlier, fewer than 10% of alcoholics get treatment. If that was somebody who had cancer, they wouldn't come out of hospital until they were well.
I think a lot of the time we get people at their lowest ebb, so that they've really felt like they've hit rock bottom, and they ask for help and they want the help. And what they have to realise is that help isn't available at the touch of a button. It takes a lot of planning, and there's only so much money to go round for these people to go into sort of dry units, or to go to places where they can be sponsored and be looked after. It takes a lot of infrastructure. You can't just sort of wave a magic wand and someone suddenly jumps into a unit like that. So, there is help there. You just have to bear with this sort of thing.
We're talking about alcohol, looking for your calls on 0845 60 60 973. The time now is 7:46. Adam Moore has the travel.
On the train's mainline services
7.3.
That's Clive Ball. He'll be here in 10 minutes, and during those 10 minutes we're going to take a few more of your calls on alcohol. I'm here with Dr. Gautam Mehta from the Royal Free, liver specialist, and also Tommy Lemon, who's a very, very, very famous London Ambulance Service paramedic, having been all over our telescreens last week. Let's go to Shazia in Watford.
Hello, hi.
Hi, Shazia.
Hi. I rang in because of Cindy's call. Now, she felt compelled to call. I felt compelled to call on her behalf, really, just to pass a message on, because I work in mental health services for children and young people, and I've worked with young people where their parents or a parent of theirs has been an alcoholic or suffered with alcoholism, whether it's binge type or any type. And Cindy, I heard her saying that she'd cooked for her kids, she'd done so much that obviously they're very important to her. And if she can use that as a focus to understand that their core belief is formed from what they experience in their development in childhood. Now, their core belief will be formed by what they're seeing. And if they see their parent in such a state every 3 weeks, that's going to form part of their core belief, and that's how they are then going to view the world as they grow up. And that's going to influence their opinion of themselves as well. And they may well end up accessing mental health services as a result.
But how does that help Cindy now, as it were, who's clearly, in the quite advanced stages of an illness?
I suppose I'm thinking she needs a focus, she needs a goal, she needs a reason. And if she's tried it being for herself and that hasn't worked, I'm just thinking that if she can actually see what it would be like for her children who seem to be important to her, whether that would be something that would be positive. You know, is she aware that that's something that they might end up accessing mental health services as a result of their experiences?
Okay, all right, thanks for that, Shazia. Thanks very much indeed, and maybe Cindy will still be listening, and if not, we've got her phone number anyway. Chris in Hemel Hempstead.
Hello there.
Hi, Chris.
It's just going back to the original topic about price increase and all of that on the alcohol.
Yeah.
If we look at increasing the price per unit, whatever it happens to be, I think we're going to end up with more people actually being ill in hospital, seeking cheaper, non-alcoholic alternatives. So basically they think it's vodka with all these other chemicals mixed in. We've already got a massive problem with this, with the import duties not being paid, not made to the standard it should be. Surely if we keep increasing the price, people are going to be seeking these all the time and end up with more liver damage, more illnesses and more problems.
So basically the problem we've got is just that people want to be kind of out of it. They don't care what the product is.
Well,
do you think there's anything in that? Let me just ask Tommy Lemon what he thinks of that. I mean, I was struck by your programme last week, how many of the people you're visiting seem to be drinking those like incredibly cheap cider, the really strong ciders and so forth. I mean, do you see people just taking anything that it takes to get completely out of their skulls?
Yeah, very much so. The sort of £2.50 bottle of white cider, you know, no names included, but we see people drinking it all the time. But the main thing is they will find any way they can. When alcohol gel first came out, it was more like an alcohol based watery type substance. People were stealing it from hospitals and drinking it. Then they had to make it into a gel, then they had to make it into a foam, then they had to start padlocking the bottles to the walls. It is just to get a fix. It's not because they really want to enjoy that white cider. It's because they just need to they want to stop shaking, they want to stop having seizures, they want to...
So Chris has got a point.
I think we need to we need to focus on the problem rather than
Gautam Mehta.
I mean, addiction's a terrible illness, and you're right. People will, I guess, try and get their kicks where they can. But I've never seen anyone with liver problems from alcohol gel or another substitute. And I think the amount you need to drink to really damage your health. I think people might get pretty fed up of the other stuff. I'm not sure that's a real long-term health problem, but you're right. Some people do really go to extremes, and that just shows what a horrible illness it is.
Yeah. Thanks for that, Chris. Let's go to Abbas in Redbridge.
Hi there. Good evening, guys. Thank you for having me on.
Pleasure.
I mean, what I'm about to say is probably going to be quite unpalatable for a lot of people, but I would hope that people would look at it within the context of of it being a knowledgeable or a beneficial statement rather than where it comes from. In the Quran, Allah very clearly says that in both gambling and intoxicants, there is only benefit for a few. But because it is a greater evil to mankind, we have made it forbidden for you. Quite a profound statement if it had just come from a man in a desert 14 centuries ago. To know the scale of what the problems would be with alcohol, with drugs, and with gambling. I hear these conversations again and again on radio, on the TV, and we always seem to be sort of trying to bolt the gate after the horse is bolted. It's quite clear that, the level of education, the sophistication of society, knowledge, all of these things have increased, and yet our dependency to these intoxicants, these stimulants...
So do you think it should be banned? Do you think it should be... Do you think we should have prohibition?
My personal view is that there is enough evidence now to clearly show, and I think many intellectuals have made this argument as well, that had alcohol been invented today...
I agree with that.
It would be a banned substance.
So, yeah, tobacco as well.
Exactly, and I think that that's what makes it even more profound, that Islam actually 14 centuries ago said that, there is, if you wish to prosper, the Quran says, abstain from such activities. It affects your prosperity, it affects... your health, it affects everything within society. And of course, we're talking about 1 in 25 people, 25% of the population drinking too much, and it affecting them adversely. How many people do those 25% then go ahead or affect further? And so what scale of this problem do we actually have?
Okay, Alice, thanks for that. I'm going to go to Gary in Hammersmith.
Hello there.
Hi, Gary, how are you?
I'm very well, thank you. Just an issue that I don't hear mentioned very often is availability.
Oh, listen, I talk about it all the time.
Oh, really?
Yeah, you can buy cheap booze in a petrol station.
Exactly. And years ago, it just used to be down to the landlord in the pub. Maybe he had an off licence adjacent to the pub, but now it's available everywhere.
Yeah.
And so I blame supermarkets.
Yep. Well, that's another reason why the pricing issue is the one that we keep going on about, because the supermarkets are able to undercut the... And one of the ironies of this is that the pub is in decline at a time when drinking is on the rise. So I'm totally with you, Gary.
Which is a real shame as well, because there's a big social side to the pub.
Absolutely, and you get all the checks and balances and all the rest of it.
Exactly. There's no social side of a supermarket. I mean, they're ruining everything.
Well, not everything. They're not ruining everything.
A lot of things.
Okay, so Tommy Lemon, as a paramedic, I mean, how much of your work is calling out to people who are drinking in the home? How much are people who are drinking in pubs, and how much are people drinking on the streets?
Like I say, I can only talk about the stuff I've gone to, but the main problem is people either literally sitting on a street corner and drinking a very, very expensive bottle or very cheap bottle of white cider, or you go into the nightclubs where someone's been happy to spend 100, 200 quid on shooters and shots and champagne and then doubles and mixers, and they're the people that we go to most of the time on the weekends. Basically just sort of lying in the gutter. They've been moved out by the bouncers. They've probably been sick on themselves. They haven't looked after themselves.
Never mind sick. You had a guy who did something else on you last week, I saw. We don't want to go into that, do we?
No, please.
Dr. Mehta, just give us a sense of your workload. I mean, you talked about how it's affecting every single ward, but What actually happens to somebody who's got cirrhosis? I mean, what is it like?
Oh, look, it's a common illness, you know. Like, I think overall it's approaching sort of 5% of the population. But look, it's if you've got alcohol cirrhosis, and you carry on drinking, like I said, your chance of getting through the next 3 to 4 years is 50-50. So it's a fatal illness. And Gary was dead on, actually. Availability is key. You know, I don't know about you. When I go down to the supermarket, you can buy cheap booze in every section, the clothing section, on the way to the checkout, everywhere. It's a big problem.
Well, listen, can't believe it's been 4 hours. Thanks very, very much to Tommy Lemon, heartthrob of the London Ambulance Service. Thanks to Dr. Mehta from the Royal Free. A couple of numbers, if I may. Alcohol Concerned Drink Line, 0800 917 8282. And the Samaritans as well, 084 57 90 90 90. I'm Alistair Campbell, and I've enjoyed, it says here, sitting in for Ian Dale on LBC 97.3. I might be back another day, who knows. He will be back tomorrow from 4 o'clock, but coming up next, it's none other than the living legend that is Clive Bull.
Thank you very much indeed. And coming up after the news, as Tesco reveals that more than half of its bagged salad is thrown out and nearly half of its bakery products, is it the supermarkets or the consumer to blame for this waste of food? Do you find yourself throwing away food? 0845 6060 973 is the number to call. And then later